Hi everybody. My name is Tanya Diddick, and I'm a fourth-year nursing student graduating this year from the University of Alberta here in Edmonton. So I've had type 1 diabetes for 20 years this July, and just a bit of background, I've been on insulin injections, an insulin pump for 8 years, and also on insulin pens as well. So I've been involved in diabetes research, working in a lab. I sorted microscope slides into alphabetical order for a little while. I've acted as a spokesperson, giving speeches at golf tournaments and hockey games, and I've also been involved with the CDA camps for kids with diabetes, both as a camper when I was young and then also more recently as part of their medical. So today's presentation will go over the members of the healthcare team, and we'll take a closer look at what their role is, how they can help you both on an individual and collective level, so as a team, and then we'll look at a few scenarios as well. Near the end, we'll open up the platform here for some questions, and again, like as Maria said, so if you have any questions that you want to type up in case you forget them, you can put them in the little chat box, and if I can get to it right away, if it's a quick question, then I'll try to answer it, but there's still a chance I might just have to wait until the end of the webinar. Okay, so first things first, who is included in the healthcare team? So the members of our healthcare team, we have the endocrinologist, we have the nurse diabetes educator, your dietitian, psychologist, pharmacist, family doctor, optometrist, and podiatrist. Is a physician who specializes in the endocrine system, and the endocrine system includes the glands that secrete hormones into your blood system. So this includes the pituitary glands, adrenal glands, your thyroid, hypothalamus, and your pancreas, which most of us should recognize as the organ which is responsible for secreting insulin. So upon diagnosis of diabetes, you can be referred to an endocrinologist. They're experts in providing patient education and the physiology of diabetes and how it affects your other body systems. They're really helpful for giving you the basic foundation of information that you're going to need to manage diabetes. They review blood work and screen for co-occurring illnesses and complications. So how often you see your endocrinologist depends on your own needs as well as their availability. So endocrinologist will also treat other people with endocrine disorders such as hypothyroidism, Cushing's disease. Next we have the nurse diabetes educator. So they are a huge part of your healthcare team. So they help review your blood glucose monitoring and look at your insulin trends. So those nice sheets that you fill out with all your blood sugar levels, with what you're eating and how much insulin you're giving. So you can look at trends and sort of look at what's going well, what challenges you're facing with your blood sugar levels, and trying to work out some of those areas. They ensure proper detection and treatment of hypoglycemic and hyperglycemic levels. So making sure you're aware of your symptoms and carrying around something to treat your low blood sugar levels. They're aware of new technologies regarding insulin administration, so pump therapy and continued glucose monitoring therapy, or CGM, new lancets so you don't have to manually change them every single time, etc. So they have many tools and resources that make living with diabetes a little bit easier. These can be fancy pump cases or more trendy medical alert bracelets. Another strength of the nurse educator is their ability to provide social supports and community links. So with social media, there's an increase in support groups for people with type 1 diabetes and also parents of kids with type 1 diabetes. They also have a lot of links to fundraisers and conferences. Also, with permission, nurses are able to link up clients who they have who are in the same demographic who might be able to relate and support each other with diabetes. So there are some things that we all know that people without diabetes can't completely understand, and it's just something that you live with, to actually experience. So it's easy to bond over little things, such as, digging through the garbage to get a carb count on that can of soup you accidentally threw out, or trying to figure out where to put your pump when you're wearing a dress, having to carry a big bag around wherever you go, being nervous about going through airport security with your diabetic supplies. So the nurse educator is also really good at guiding the transition from pediatric to adult management of diabetes. As kids age, they'll gradually accept more responsibility for their own care. So practicing giving an injection for the first time can be a lot easier when you have that nurse there guiding you through the process. And I remember using, they had jelly abdomens that you can practice giving needles on if you're nervous about giving it to yourself. They cover a lot of education, what to do on sick days, drinking in type 1 diabetes, having a healthy pregnancy as a person with type 1. And I like to think of the nurse educator as sort of a gatekeeper, and they're experts at being generalists. So they have a really good holistic view of the patient. So when you're at your appointment with the nurse, they're really good at getting the whole picture and maybe seeing, maybe you're having issue with carb counting. So they'll make sure that you talk to the dietitian and that you get the issues with carb counting sorted out. Or maybe you're really stressed about social situations with your diabetes, and they can help talk through those things and maybe make sure that you see a psychologist. So making sure that they're really good at making sure you access the whole healthcare team. So the next member of the healthcare team is the dietitian. So dietitians are experts in providing nutritional information and helping people with diabetes create healthy, well-balanced meal plans that cater to their personal preferences, their metabolic needs, different social situations, and exercise habits. So social situations are a huge challenge for people with diabetes. We've all been to that potluck dinner where we're trying to figure out how much insulin to give for these dishes, where we really have no idea what the ingredients are. They're also really helpful with getting good at reading food labels and counting carbohydrates. So just a little anecdote. When I was younger, I used to be able to pour out 32 grams of Cheerios and exactly 6 ounces of milk, because that's what I had eaten for breakfast for the last 3 years. And it sounds kind of crazy, but with my parents, it was just one factor that sort of minimized the huge number of variables that could have an effect on my blood sugar levels. And that worked for a long time. And I just remember the dietitian, she's looking at my charts, and she said, "Aren't you getting sick of eating Cheerios all the time? Let's look at some other breakfast options for you." And so we worked, and we were able to find some other breakfast foods that I like, and work out getting the nutritional information for those foods and incorporating them into my meal plan, and still keeping good blood sugar levels. So the next point I have here is celiac disease. So many people are now a lot more aware of gluten intolerance, and it's said to affect about 1% of people with type 1 diabetes. So as it's getting more popular, it's kind of a fad right now. As a means of managing a healthy weight, there's a lot more information and food available that's gluten-free. Dietitians are an incredibly valuable resource for people with celiac disease and for finding good-tasting gluten-free foods. So they have huge lists of ingredient names that contain gluten, so what to look for on ingredient lists, and they also have a lot of resources. So if you've ever been on a gluten-free diet, you're very aware that some of the gluten-free alternatives for foods do not compare in taste, and they also tend to be more on the expensive side. So it's good to be able to hear from someone who talks to a lot of people with celiac disease about what foods are actually good and worth spending the extra money on and where you can get those foods. So finally, due to the heavy focus on food and the difference in control over eating habits and patterns for people with type 1 diabetes, so things like eating when your blood sugar is low even if you're not hungry can be a trigger for people with diabetes, so they're at an increased risk for eating disorders such as bulimia, binge eating disorder, or diabulimia. So if you think that you or a loved one is at risk for one of these illnesses, talk to your dietitian and they can help you access the resources you need. So next is the psychologist. So a lot of the healthcare professionals that we've mentioned and are looking at focus on more of the biological and physical aspects of diabetes management, but the psychologist specializes in social and mental well-being. Diabetes is a chronic illness and has a lot of effects on personal relationships. So people with type 1 diabetes are at an increased risk for stress, depression, and anxiety, especially related to their diabetes. They have additional stresses that people without the illness don't have to deal with. And I've heard people make all kinds of analogies to diabetes. So one of the ways that I explain it to people who know nothing about type 1 is I sort of compare it to, I say, imagine if all of a sudden your body didn't regulate its temperature properly. So you know that there are a lot of factors that can affect your body temperature, and imagine if you had to monitor that temperature all the time and you had to try keep it in a range, and you go outside and you go up, your temperature goes up, and you go in the winter and you're constantly trying to get this number in a certain range. And that way people can kind of understand, they go, oh wow, that would be really tough. So that's kind of a way that I've found to explain, like, trying to keep your blood sugars in a certain range, and trying to understand some of the feelings of frustration that you can run into when you're just stuck in a rut and your blood sugars aren't at the level that you want them to be, and you want them to be lower, but for some reason you're stressed out and they just keep on going high, and so you don't want to do blood tests, and it can get really overwhelming. Diabetes doesn't go away, and it's completely normal to feel overwhelmed and to get caught in ruts or patterns of poor blood glucose at some times in your life. So it's not a sign of weakness to talk to a psychologist. They can help you through a lot of the challenges that you're facing. So if you're feeling overwhelmed or stressed or down, try talk to someone before it gets bad. Okay, so now we have the pharmacist. So you probably recognize them as the person behind the counter who fills your prescriptions, and they might even know you by name right now because you go there so often to get all your test strips and your other supplies. So they know all of the medications, they know the drug-to-drug interactions and the side effects, they're a really good resource if you're put on other medications for other health conditions that can affect your blood glucose. So a couple examples of this are steroids that are anti-inflammatories for an infection, say. Those can raise your blood sugar. Birth control and antibiotics can also affect your blood glucose levels. So the pharmacist can give you a bit of a heads up so that you're not so shocked to find out that your readings are high even though nothing else has changed. So another more recent addition to the scope of practice to pharmacists that not as many people really know about is their ability to prescribe medications. So they have specific restrictions, and they're by no means the main source of getting a prescription. You should be going to your family doctor. But it can be very useful in a bit of a bind. Personal experience that I had a couple years ago, it was the middle of finals, and my insulin pump had broken on me. It had just malfunctioned, and with the insurance, I wasn't able to get a new one, and it was about 9:30, 10 at night. My doctor wasn't available. I didn't feel really like going to emergency just so that I could get a prescription for long-acting insulin. I only had a prescription for short-acting insulin, which is what you would use in an insulin pump, and I hadn't used any long-term acting insulin in 8 years. So I was at the pharmacy and I was just almost in tears at the counter saying, my pump broke, I have a paper due tomorrow, like I have an exam coming up, what can I do? Like I need some insulin so that I'm not giving myself a syringe every hour. And they were able to write me up a prescription for a long-acting insulin. They gave me the peak times and helped me kind of come up with a plan. I was able to get to my regular doctor a week later, but for that time I was incredibly grateful that they were able to do that for me. So I think that the pharmacist is someone who you don't traditionally think of as that supportive member of the healthcare team, you know, but they're extremely valuable. So the next member we have here is your family doctor. So they're responsible for your regular checkups, for all your other non-diabetic health conditions. They do referrals if you need to see a specialist for another condition. They'll fill your prescriptions. And also here in Alberta, if you have diabetes, you need to get a medical form filled out in order to get your driver's license, so they can also do that for you. So next we have the optometrists, who do your regular eye checkups. So for people with diabetes, eye health is incredibly important because of the risk for damage to the retina and your increased risk for glaucoma. So when your blood glucose is high, the blood becomes more viscous, it's more syrupy, and it's more difficult to circulate throughout your body. So the optometrist can put eye drops in to dilate your pupils, where they can actually visualize the blood vessels. So from there they can detect the risk for damage. So we also have the podiatrist. So diabetic peripheral neuropathy is another complication of high blood sugar. Because of the effects on the circulatory system, you might not be able to feel cuts or bruises in your feet, so it's important that you check them regularly. So the reduced circulation also reduces the amount of white blood cell flow to the feet, which can lead to infections. Alright, and lastly we have our other supports. So our social workers, our spiritual leaders, or religious figures who can help support you with your diabetes management, or like the psychologist and the nurses, like a lot of the other social, emotional, spiritual well-being aspects of health. Also, family and friends are huge sources of support in your diabetes management. And finally, the last important member of the healthcare team is you. So how you access the healthcare team and how you utilize these healthcare professionals is going to be the ultimate determining factor in how you choose to care for your diabetes. All right.
Okay, so I'm just going to talk for a minute about the Canadian Diabetes Association and our role in supporting people with diabetes. So one of the things that we offer is a lot of resources. We have resources and publications on a ton of different topics, on a lot of the different complications from diabetes, and all these things are very easily available on our website, which is just diabetes.ca. We've also recently redone the website, so it's much more user-friendly and it's very easy to find the resources now. So if you just want to look for some general info on the complications, do a little reading, you can definitely go to our website. And also online we have a lot of recipes. The last time I looked there was over 100 different recipes. They all have the nutritional information, and since we changed our website it's really easy to search for them. You can filter it by the main ingredient, so if you want a chicken dish or a beef dish or if you're looking for dessert, you can do that, and you can also filter it by the type of meal you're looking for, so breakfast, lunch, dinner, dessert, or snack. So that can be really helpful if you're stuck trying to think of a healthy recipe for supper. It's also all on our website. So some of the other things we do are events and programming. So like this webinar, we're always doing different types of community education. So we also do expos, which can be really large. We have annual expos in certain cities throughout the year. Sometimes they're more of, as opportunities come up, we'll do them, or we provide, if a speaker is interested in talking about something, then we'll create an event for them. So we're always trying to just keep people informed, get people to a time to come together and learn more about their diabetes and keep on top of the newest trends or the newest information. We also offer D-camps, which I'm sure a lot of you are familiar with for kids with type 1, so those are across the country. Again, lots of information on our website about D-camps. And we also do advocacy. So there's a couple different ways to do that. So if there was an issue, like let's say you applied for a job, you didn't get it, and they said it was because you were a diabetic, then that is something that you could contact us about and we can work on you with. If any of that sort of like discrimination, those kind of things, we have a department to help people with that. And something that we recently just released this Monday is the Diabetes Charter for Canada, which outlines the different rights and responsibilities of people with diabetes and also those involved in their care. So it's not a legally binding document, but it just says this is what you can expect of your healthcare providers, the reasonable expectations, the things that they should be providing you with, and those things that you should be expecting of yourself to do, of your family, of your friends, different things like that. So it's kind of a resource you can use. If you want to show it to your healthcare professional, you can also sign it on the website to show that you endorse it as well. So that's just a very small snapshot of the CDA. The programming does vary by region, so there might be something a little different out in BC that you've heard of, or maybe out in the Maritimes, but in general, these are the kind of things that you'll find across the country that the CDA does.
All right, so our first scenario is Jordan is a 17-year-old athlete who's had type 1 diabetes for 12 years. He's been using insulin injections, but is now interested in getting a pump. He's also started drinking with his friends. Who should he talk to? Yep, so the nurse is a great resource. I think also what a lot of people do in this situation too is he might feel more comfortable talking to other people around his age and seeing like what they do when they drink, right? Because everyone's a little bit different. So I think, yeah, the nurse is a great resource, and I think it would also be good to talk to other people his age and see what they do.
should speak with his family as well. I think that's a great point. You don't want to forget about those sources of other supports that we talked about as well. So family is definitely a good place to go.
Yeah, like Russell said too, lots of changes around this age period too. So that transition from high school to maybe post-secondary education, is he moving away? Is he going to be living in residency? Drinking is also like extremely prevalent at grad type celebrations, right? So it's important to ensure that he has a safe plan for drinking and celebrating his graduation. So scenario 2, Stephanie has had type 1 diabetes since she was 8 years old. She recently moved from Edmonton to Calgary to attend university. What steps should she take to find a new healthcare team? Also, she is now cooking for herself for the first time in her life and controlling her own daily schedule. How can she manage this transition best? Providing a referral like Marcy's typed out is another really good option. Another thing too to consider is the move to Calgary temporary? Is she going to be there for the whole year or just the school year? How often does she have appointments right now? Who would be a good resource for the cooking for herself for the first time? Any ideas? The CDA? Yep. So we have the list of recipes, as Maria mentioned. So Leanne is a 35-year-old mother of 2 and has had type 1 diabetes for 25 years. Her blood sugar levels have been very scattered the past week, even though she hasn't made any changes to her daily routine. She feels okay but is concerned about the strange readings. Who should she talk to? Yeah, the endo is a good resource. A lot of the times, like, the nurse should be able to answer these questions too. I would want to see if Leanne was maybe logging her blood sugars. A lot of the meters and the pumps now have programs that you can download, and so they can chart on the computer. You can look at your trends that way.
I think what we've seen so far for a lot of these is that it's not necessarily cut and dry who you need to go talk to for certain issues. There's some overlap with a lot of the providers, and you can always kind of talk to a couple different ones, whoever's maybe the available the soonest or something.
And as for are there doctors, nurses available 24 hours? We want to see, is it an emergency situation or are they just a little bit higher than usual? So if it's something that like puts you at risk for DKA, if you're worried about like diabetes, ketoacidosis, that's an emergency situation. So if it was non-emergency, you would probably want to see if your nurse or your doctor is available by phone, and if a conversation over the phone could maybe try problem solve.
I think someone at the bottom has said that the most important thing is to get into the system without delaying too much, so that's a good point. So if you call your doctor, maybe you can't see your doctor for another week or two, but you know that where your pharmacist is, so you think, well, at least there's a starting point that you can go to them right away. Or you think, maybe I'm just going to go to Emerge or whatever it is, but finding, depending on the circumstances, finding the easiest point of access for sure.
Okay, so our last scenario, Deborah is in her mid-20s, has had type 1 diabetes for 20 years, has 3 children and very little social support. She feels like she's going nuts on a daily basis and doesn't have time or resources to cook expensive meals, go for a walk, etc. A lot of the time she doesn't have energy to do stuff with her kids and depends on the television. Where can she find some support? Check with the CDA for some social support groups in their area. So I think that's a great idea. Talking to other adults with diabetes who have had it for a long time. Sometimes it can be overwhelming, right? And you can get tired of the same routine.
And maybe something else for this one as well, depending on if it says she feels like she's going nuts, so we talked about the psychologist and how maybe you should go visit them before when you feel things are going downhill as opposed to when things have gone completely terrible. So maybe she could think about going to talk to her doctor about getting her referral to a psychologist. Just as a preventative thing, talk things through. That could be really helpful for her as well. Yeah, thank you everybody. We really appreciate when you come out and attend these, especially because this is a pilot. And just on that note, a friendly reminder that we'll be sending out that survey tomorrow. It should be in your email kind of late morning, early afternoon. So if you want to give us some feedback, that is always appreciated. And as another reminder, our next webinar is going to be on May 8th, also at 7 p.m. Mountain Time, and that's going to be on psychosocial issues. So we're going to, we're looking forward to talking about that with everyone as well. So thank you again for attending and have a great evening.